right. Speaking of an inspiration as well, we have Dr. Nate Ruck. Dr. Zen, you had some great slides here, so I'm going to just turn it right over to you.
Sounds good, thanks. In the spirit of keeping things on time, you can go ahead to the next one. I just want to start out by saying thank you to all the business colleagues and support folks that are listening today. You know, in the clinical lane, we could not do what we do without your support, and it is very much noticed and appreciated. So I wanted to spend our time today talking about these 5 things. I know that testing and what to expect if you do become ill, how COVID affects kids, what's happening with school, and what's happening with the vaccine are things that is on everyone's mind these days. It's a lot to cover in the 10 minutes I have allotted. So, you know, I'm sure this deck will be distributed afterward. So, you know, this graphic is a graphic where the yellow bars or the orange bars or whatever color that is are the daily total of tests. And we've been averaging a little over 800,000 tests per day in the US. And the thing that really, the metric, if you had to pick one metric to track, the percentage of positive tests is super useful. And I think this graph shows some really good news when, if you look all the way out to the right, you'll see that that dark blue trend line, which is the 7-day moving average of the percentage of tests that are positive, is dipping below a crucial threshold, which is 5%. And we're starting to see some slowing down in some of the states that were hardest hit. And obviously this is rolled up national data, so it doesn't necessarily tell the story where you live, but it's encouraging news nonetheless. You can go on to the next one. So a question that we get a lot is, well, let's say that I get COVID-19, what should I expect? You know, the majority of people have, you know, that one of the things that happens in the news media is there's really tremendous negative outlier bias. And I'm not at all trying to say that COVID-19 isn't serious or that this isn't, you know, having a tremendous effect on all of us, but it's important to keep a foundational understanding of what the illness means. And the vast majority of people recover without any permanent sequelae and don't require hospitalization. What this study that you see here is an Italian study that's summarized in the table, and it looks at, well, after you have COVID, what are the common symptoms? And fatigue, shortness of breath, joint pain, and chest pain are really at the top of the list. There's another study that came out recently in the Morbidity and Mortality Weekly, which looked at a phone survey of a little under 1,000 patients, and they called them 2 to 3 weeks after they'd had COVID to see, you know, kind of how they were doing. And if you look at people that were hospitalized with COVID in that group, just under 40% of people were back to normal when they were surveyed, which was between 2 and 3 weeks after they left the hospital. If you look at folks who were seen as outpatients and never hospitalized, about 64% returned to baseline. So, you know, I think encouraging news despite how serious this is. You can go to the next slide. So what about school? You know, I've got 3 school-age kids, one in elementary school, one in middle school, and one in high school. And you know, this is certainly a topic of discussion in our house, and there's no shortage of information on the national news and no shortage of discussion locally about this where you are, I'm sure. And really, I think everyone's wondering, well, you know, what conditions are needed to open schools safely? What role do kids play in the transmission of COVID in communities? And you know, what do the schools need to do? So let's just go through a couple slides that discuss that. You can go ahead to the next one. So setting the foundation for this, let's talk a little bit about what COVID-19 infection means for kids. I think it's important to underline that the illness severity is really a lot less in younger patients, particularly those under the age of 9. 23 states have not recorded any pediatric deaths despite having thousands of cases. And if you look at roll-up data of all the cases in the US, and this is current through a couple of weeks ago, children only represent about 3% of total hospitalizations and less than 0.5% of all deaths. In kids, you know, just like in adults, fever is the most common symptom. I'm sure all of you have heard in the news about, I'm missing a hyphen in this slide, but the MIS-C, that this inflammatory the post-infectious inflammatory syndrome that can be seen in some kids. And that certainly has been an issue, particularly in areas like New York that were really hard hit. New York is a state of 20 million people. And just to put in perspective how much of an impact this has had, there were, really probably about 135 cases out of those 20 million people. Obviously, all those aren't kids, but it's incredibly rare, but also serious. And there's some good news in the data looking at transmission of COVID by kids. There's emerging data that suggests that kids under the age of 9 are less important than older kids and adults when it comes to transmitting to household contacts, even if they do become infected. So with that, we can move to the next slide. So what's needed to open schools safely? I think, a theme I really wanted to underline here is there really isn't a one-size-fits-all national guideline that answers these questions, and every school is different in terms of the physical space they have, what their ventilation system is like, how can they utilize the out of doors, do they have unused indoor capacity that they can expand to keep students socially distanced, and all those things are great, but really the most important thing when making decisions about opening schools is what is community prevalence, and having a percent positive tests under 5% is really, I think, going to be most important. So if you said, well, what's the one thing that could happen in a community to make schools most likely to open successfully, it would be for the community to look out for its own health by wearing masks, keeping socially distant, and doing all the things that we know can help move the needle in terms of preventing infections. So there's the third bullet point, which just says should say rapid turnaround for testing. And that's another thing that's important in schools, because being able to identify who's infected and who's not in a timely manner is really helpful. And the other thing that's definitely going to be important is flexibility. If you look at what's happened, there are states like Arizona that had really robust school opening plans, but those plans have all been changed because of disease prevalence in the communities. And I think local decisions guided by experts in science and flexibility to adapt to changing conditions. Even if conditions suggest that you can open schools safely now, that could change in a pretty short period of time. So having contingency plans for distance learning or virtual classrooms or, is really important. And I think it's also clear, though, that the majority of US schools aren't going to open with standard in-person enrollment. I think generally that will be the exception rather than the rule nationally. You can go to the next slide. So one thing that's useful to inform our decision making around what to do with school opening is to look at, well, what happened in the rest of the world? And Denmark and Finland successfully reopened schools in mid-April, and they did this on a backdrop of very low levels of community transmission. Their percent positive test was under 1%, and really they didn't move the needle and didn't really run into difficulty. Now, they also made a decision to favor younger students and really introduced a lot of social distancing and time-based distancing on the cohorts of kids that returned to school. They had the younger primary education students return first and only later phased in the older students. Israel had a little bit different experience. They also had a reopening in May. And what they did is after about 2 weeks, they relaxed some of the restrictions on class size and social distancing, and they experienced some pretty significant outbreaks that were based in certain schools, and there were infections among not only children, but also school personnel, including one school that had about 130 infections. In the US, there's been some experiences in Texas and in Missouri and in Kansas and in some other states with camps and childcare facilities that aren't schools, but share some common characteristics. And there's been difficult experiences there as well. So really, to summarize, what are the strategies that are going to work to have schools open safely? The community needs to be responsible for its own health, and we have to have low community prevalence. All the things that you hear about in terms of social distancing, masking, no big assemblies, and testing with rapid turnaround is really important. All this being said, flexibility, I think, is really going to be the key, because whatever the best evidence-based plan is today, evolving knowledge about how we deal with COVID-19 and changing rates of infection in the community are going to play a big role. So vaccines, I think in the interest of keeping things on time, I know you have a lot of other pieces in the agenda. I won't go through the different phases of vaccine development. You can go to the next slide. And I think this next slide is really awesome. So Project Warp Speed, as I'm sure some of you are aware, is a government program where, it's one thing to identify a vaccine candidate and then do a large-scale trial and make sure it's safe. And it's another thing, though, to have the manufacturing capacity. Even when you think about deploying a vaccine on a global scale and you think about, well, how many pair of gloves do you need to, immunize X billion people? How many syringes do you need? The manufacturing piece of it is almost as difficult as the vaccine development. There are 6 vaccine candidates that are in large-scale efficacy trials now, and there's, I think, really encouraging news coming out. I'm hopeful that, by the middle of next year, we'll have, a vaccine available at scale. That one vaccine that's listed as approved for limited use all the way on the right is approved for limited use in China. It was approved via the Chinese military, and I don't think is a great candidate to be available in a widespread way in the US. So I think this, to me, is one of the really, this is the Apollo program of our generation, is development of this vaccine, and super exciting to see everything that's moving forward. You can go to the next slide. So I wanted to take a minute and just talk about some things that you hear about out there and just clarify what's fact and what's myth. There's been some things in the lay press about prolonged mask wearing leading to CO2 retention or CO2 intoxication. Surgeons regularly do 12 or 14-hour surgeries wearing surgical masks. Now, if you're wearing a cloth mask that becomes, grossly contaminated or dirty or wet, that may cause you problems breathing. But if you're wearing a surgical mask, which are pretty widely available, made out of, an expanded synthetic fabric, that's not going to lead to any kind of problems with CO2. Thermal scanning, you see this if you go to get a haircut, you'll see it if you go to the airport. These really don't detect COVID-19. What they do is they see if you have a fever. And even in the setting of a pandemic like this, COVID-19 probably isn't the leading cause of fever. So, those thermal scanners are certainly an important part of infection mitigation, but they don't detect COVID-19. And the final point is really worth underlining, particularly given what's been out in the lay press recently. There really are no drugs licensed for treatment or prevention at this point. There are some fantastic therapeutics. I'm particularly excited about monoclonal antibodies, and I think there's going to be more good news emerging there. For hospitalized patients requiring oxygen, there are some things that make a difference, but for folks that acquire COVID-19 and don't require hospitalization or oxygen, there aren't any licensed or available treatments. The treatment is supportive. You can go to the next slide. So I've got 3 slides here, which, Annie, if you are in need of the time back, can be informational in the deck. Another thing that we get questions about is, well, what is safe to do? And I think the exact answer depends a little bit on what's happening in your community, but these are 3 slides of kind of low, medium, and high risk activities that were put together by the IDSA, or the Infectious Disease Society of America. And what they go through is, when, you don't need to be using a waiting period for your Amazon packages before you open them. But there are also some things like, going to bars or eating out at a buffet or, going to play the slot machines in Vegas that you need to be, really worried about. Those are higher risk activities. And these 3 slides that, Annie just went through kind of summarize that. I think this may be the end of my content. You can go to the next one.